Greeting of the day to all and everyone. My name is HORMOT PYNGROPE and I am going to talk about pre-participation physical examination. Before we go to the main topic, let us look at the outline of what are the main points that I am going to include in the talk. Introduction, goals and objective, where to perform PPE, components of PPE, and when to perform PPE. Pre-participation physical exam PPPE or pre-participation evaluation PPE. Pre-participation physical examination has become an important and critical aspect in both sports and recreation. Pre-participation physical exam is an important part of getting ready to play and organize sports. It helps the athletes to maintain health and safety during training and while competing or participating. Goals and objectives. The main goals of PPE are: the overall goal of PPE is to help maintain the health and safety of athletes. The purpose of PPE is not to exclude athletes from participation, but to promote safe participation. If not clear, most athletes can be rehabilitated or redirected to another sports. Objectives. Objectives of PPE can be classified into two main objectives: the primary objectives and secondary objectives. Primary objectives. The main three primary objectives of PPE are to detect conditions that might predispose the athlete to injury. Second one, to detect the conditions that might be life-threatening or disabling. And the third one is to meet the legal and insurance requirement. Secondary objectives: to determine the general health, counsel on health-related issues, and to assess fitness level for a specific sports. Where to perform PPE? PPE can be performed in office space or as a mass. That means in office-based participation evaluation, where the athlete's primary care doctor can be performed the exam, and in mass participation evaluation, where multiple specialists can be involved, such as the athlete trainers, physical therapists, orthopedic surgeon, family doctors, and pediatrician who have a specialized interest in sports medicine. The components of pre-participation evaluation. The medical history is the cornerstone of any medical evaluation. A complete history will identify about 75% of problems affecting athletes. The recommended baseline history includes the following general information: medical condition and disease, history of surgeries, histories of hospitalization, medicine, either prescription medicine or over-the-counter medicine or just as supplements. Allergy history, maybe it's a allergy to medicine or allergy to insects or to any environmental condition. History of immunization status, menstrual history, psychosocial sexual development history. Other information about the following should also be included in history, such as cardiovascular condition, pulmonary condition, neurologic, nervous system including the brain and musculoskeletal, injury or illness since last exam, and history of concussions. PPE is a screening tool that emphasizes the area of greatest concern in sports participation, an area identified as problems in the history. The recommended standard components of PPE includes the following: 1. Height, 2. Weight, 3. Pulse, 4. Blood pressure, 5. Eyes, 6. Ear, nose, throat, 7. The heart, 8. Abdomen, 9. Genital, 10. Skin, and 11. Musculoskeletal system. When to perform PPE? Ideally, PPE should be performed at least 6 weeks before pre-season practice. Why? Because let's say if an athlete is not clear, so that the athlete can be rehabbed and if needed can be redirected to the another sports which is suitable for the individual. Thank you.